My name is Alani Morsi, and today I will be discussing phobias. I will be going over what causes phobias, the different types of phobias, how common they are, and their symptoms and treatments. Phobias are continuous irrational fears of objects or organisms that can inflict little or no harm. It could be a specific phobia, agoraphobia, or a social phobia. Specific phobias focus on one object. Social phobia is a fear of being embarrassed in a public setting. Agoraphobia is a fear of being alone without any escape. When having phobia, your anxiety gets so bad that you tend to avoid these situations altogether. If they are unable to avoid, they will begin to show symptoms. For example, if you have veophobia or a fear of driving, you'll always take cars, Uber, or simply ask for someone to drive you around. Someone close to me I know has this phobia. All phobias experience both physical and psychological symptoms. These symptoms often occur suddenly and without warning. Symptoms include sweating, trembling, hot flashes, difficulty breathing, a choking sensation, rapid heartbeat, tightness in chest, a sensation of butterflies in the stomach, nausea, headaches, dizziness, or numbness. In more severe cases, you experience psychological symptoms like losing control, fainting, feelings of dread, or fearing of dying. You can also feel panic, worried, and get very anxious. They can't stop thinking about what will happen if they are near their phobia. It's almost like Final Destination, where there are so many possible outcomes which all end up bad. People experience fears with moderate intensity, but it always passes. For phobias, it is very different. Phobias are intrusive and affect your day to day life. They can interfere with your work and relationships. With regular fears, you can overcome through willpower. With phobia, symptoms cannot be ignored or wished away. A phobia is a fear you are born with. Phobias are the most common mental disorder in the U.S. Approximately 10% of people experience some type of phobia, according to the National Institute of Mental Health. 6.8% of the adult population and 5.5% of the teenage population is affected. Men are also less affected by phobias than are women because more men are likely to seek help. Genetic and environmental factors can contribute to the start of phobias. Traumatic events or stressful experience are the most common causes of development of a phobia. Children can also be influenced by adults to have a phobia. Most phobias actually begin during your childhood. They are often first seen from ages 15 to 20. It is rare that phobias develop after age 30. The first example I have is acrophobia. Acrophobia is extreme or irrational fear of heights. Acrophobia can range from standing on the top of a chair to standing on the top of a floor of a building. They begin to feel panic because they can no longer trust their balance. If they lose their balance, they will fall and hurt themselves, which is really why they have the condition. Nobody likes being hurt. Next is trypophobia. Trypophobia is a fear of irregular patterns, bumps, or clusters of small holes. Many people do not realize this, but trypophobia is around us all the time. For example, the class has a pattern of holes on the back of the rolly chairs. This can trigger people with a severe case of trypophobia to experience symptoms that I have previously mentioned. Acrophobia is a morbid fear of sharp objects. People have this phobia when they are afraid of being cut, stabbed, or injected with sharp objects. These objects range from pencils to knives to needles. Anything with a pointy tip can trigger this fear. The more you are triggered by objects, the worse your condition. Claustrophobia is the fear of small space/rooms that cannot be escaped. The cause of this fear can be from genetic vulnerability and life experience. Being trapped anywhere for a duration of time can scar you for life. One time, I actually got trapped in a bathroom when the door handle got jammed, and I freaked out. Nyctophobia is the fear of the dark. Being afraid of the dark develops when you are young and it is seen as normal. Some kids just get over it, while others are stuck with this fear for the rest of their lives. People who do have this fear avoid it by using nightlights, their TVs as light, or flashlight. There are many sources available nowadays to avoid the dark, like phones. Colorophobia is a fear of clowns. An estimated 12% of adults have a fear of clowns. They were originally supposed to bring people happiness and laughter, but ended up bringing people fear. I believe people started to have this phobia when John Wayne Gacy and it became popular in the US. Arachnophobia is a very popular phobia. A lot of people fear spiders because of the creepy fact that they have 8 legs and several eyes. Maybe it is because you are freaked out by the feeling of them crawling across your skin. Maybe you're just scared of their bites. Whatever the case, spiders are not harmful and their bites have no more effect than a mosquito bite. Ophidiophobia is the fear of snakes. Nearly one-third of adults are believed to have a fear of snakes. Snakes are like clowns in which they are creepy and only a scary image to Americans since popularized by TV. Most people fear their venomous bites. They do not like their long, sharp fangs or the venom that can harm you. Aerophobia is the fear of flying or being in the air at all. Aerophobia can occur because of past experience, lack of knowledge, or because of imagination. It can also be from hearing stories about crashes or the Bermuda Triangle told by people, news reporters, or films. To get past this, you would have to slowly prepare to fly and then eventually do it. Mysophobia or germophobia is the fear of germs. People with mysophobia range from fearing contamination to fearing sexual intercourse. They will do anything to prevent sharing germs. They will use toilet seat covers, hand sanitizer, even go as far as wearing gloves all the time. Experts even say that the increased fear of mysophobia was caused by the such hygiene items. Astrophobia is the fear of thunder or lightning. Most people who are afraid of lightning and thunder tend to hide away during storms and cover their ears. Not only is the noise and appearance scary, but so is the speed of light and heat. Lightning travels at speeds as fast as 140,000 miles per hour and can approach temperatures as high as 54,000 degrees Fahrenheit. Cynophobia is the fear of dogs. Most people have believed dogs are the cutest thing on the planet. They are humans' best friend and are only capable of love and affection. People with cynophobia think exactly the opposite. They are uncomfortable with them being around or hearing them bark. They are most likely afraid of their bites and growls. Not to fear, they do have treatments for phobias. The best treatment for specific phobias is called exposure therapy. The goal of the treatment is to limit your phobias so you can have a better quality life. There is also recommended therapies and medication if this doesn't sound like the best option for you.